So this is the second video on combined oral contraceptive pills. So we're going to focus on the side effects, the contraindications, its use in different medical conditions. Yeah, and then continue. So what are the side effects? Some of the side effects, not very severe. Some of the side effects include things like nausea, you might feel vomiting, dizziness, your breasts might feel a bit sore, might get some moodiness, negligible weight gain, some spotting till you get used to it, some mild headache, but once you get used to it and it clears. Then major danger side effect is that they can cause blood clot, what we call DVT, deep venous thrombosis, that kills. So it's mostly due to the estrogen component of it, and especially the risk is a bit higher in what we call drospirenone containing pills, because the progesterone part of those pills, the drospirenone itself, can lead to clotting, and then when you add the estrogen part of it, and so the risk of developing a clot is like 3 to 4 times when you compare a person who is using combined oral contraceptive pills and a person who is not using. But the risk is still lower compared to pregnancy. If you got pregnant and you didn't get a clot and you don't have any risk factors, then your doctor will tailor it for you. So which patients will be in danger if they use the combined oral contraceptive pills? Which patients will be at a higher risk of developing these clots? If, for example, immediately after delivery, you are not allowed to use this. So if, for example, it's like first 6 weeks after delivery, whether CS or normal delivery, you are not allowed to use combined oral contraceptive pills. And again, remember also the estrogen part might reduce milk production. So we normally tell women to use it after 6 months, once the baby is weaned, or once the baby is no longer on exclusive breastfeeding. Okay. Then if you have hypertension that is mostly not well controlled, you might be at risk of some blood vessel issues. So you might be at a risk of clots with just the hypertension on itself. So when you add the combined oral contraceptive pill, then the risk might be much higher. Then if you have diabetes because of the blood vessel involvement, obesity, it's neither here nor there, but some people say that obesity might be related to hypertension, to diabetes, so that is what could contribute to the clot formation. But diabetes in itself is still a matter of discussion, right? And then if you're a 35-year-old and above and you smoke, then you should not use the combined oral contraceptive pill, because female smokers above the age of 35 are at an increased risk of forming these blood clots or having blood vessel issue, so you should not use the pill. Then if you have a very sedentary lifestyle, like you just sit, you don't do anything, then the risk might be real. And if you're from a recent surgery, it doesn't have to be a gynecological surgery. Like, for example, you had a broken bone and you were bedridden for a while, or you underwent surgery for whatever, or your hand. To scare you, it doesn't cause DVT, but there's a 3 to 4-fold risk of getting clots, and the risk is much higher. But the risk is still lower than pregnancy itself. Pregnancy is a high estrogen situation, but the risk is high if you have those things that I put across. So if you're afraid of this, or if you are a bit skeptical about this issue, or if maybe you had somebody who died and they were using the pill and you just want to be careful, then talk to your doctor to tailor the dosage for you, or to do a risk analysis for you and then decide whether you need to take it or not. Okay, so what are the contraindications of the pill? If you are pregnant, if you take them and you got pregnant and you're not aware that you're pregnant, then it's fine, because they don't affect pregnancy. They're not harmful to the baby. But if you're pregnant and you know you're pregnant, you should not take the pill, because I said pregnancy is a high estrogen state. So when you add more estrogen to your system, you could be at a high risk of forming blood clots, and clots kill. Be careful. Then if you haven't controlled hypertension, do not use pills. I think abroad they still use them for people with hypertension, because they have better systems to monitor your hypertension, to even just know if your hypertension is controlled or not, to check your blood vessels, to do so many things. But in our setting, we are not that careful. We don't follow up our patients that well. So if you have hypertension, better avoid. Then if you're a female smoker above 35 years old, of course. If you have diabetes, especially with vascular disease, do not use. If you have ever had a heart attack, if you have ever had a myocardial infarction, if you have ever had any heart issues, then avoid. If you're a patient who has severe migraines that cause you to have, like, some people get severe migraines that they can't hear for some time, or they get severe migraines that they can't see, what you call focal neurological deficits. So if you have severe migraines, you might be at risk of blood vessels issues in your brain. So do not use. So if you have severe migraines, if you have ever had a clot, if you have ever thrown a thrombus, like a clot to the lungs, then completely contraindication. If your family, for example, has a very high risk of what we call thromboembolism, whether inherited or not, do not use. Yeah, and if you have breast cancer or suspected breast cancer, do not use. If you have active liver disease, do not use. Or if you have any estrogen-related cancer, like breast cancer, like some endometrial cancers, okay? So if you have all this, as much as it protects against endometrial cancer, but if you have already endometrial cancer, the estrogen will fuel the cancer even more, so avoid. And then next we're going to tackle what are the dangers? What are the disclaimers you should know as you're using the pill? Number one, if you feel like you're having like a leg swelling, especially one leg with calf ni what you call the masguembes, yeah? If you have pain there and you're using the pill, call your doctor immediately. It's better you call them and then find out it's nothing than stay and find that you had a clot. Then number two, if you feel like you are getting very breathless, then you could have formed a clot without knowing and thrown it to the lungs and they could kill, so call your doctor. So yeah, so those are the dangers, the contraindications, and the side effects. I hope I didn't scare anyone. There's still a very good method to use, still has a very good return to fertility, still has it imitates the natural cycle of a woman. So if you have any questions, if you have any fears, kindly sit down with a gynecologist, discuss. To do a part 3, and that part 3, I'm going to focus on the drospirenone containing pills, Yasmin, Dahlia, etc. Thank you very much.